Hello and welcome to Coronavirus Q&A. We're here to try to get answers to your questions about the COVID-19 pandemic. Tonight, we speak to the man at the podium, the government's chief scientific advisor, Sir Patrick Vallance. Our GP, Dr. Sarah Jarvis, will be answering your health concerns. Chris Choi is here to talk coronavirus rules and your rights. Plus, Corrie's Sally gives us her life lessons for living in lockdown. We still want to hear from you. You can send us an email at coronavirus@itv.com. You can post your comment on Twitter and Instagram using the hashtag coronavirusQA or join the conversation on our Facebook page. That's all to come, but first, here's what you need to know. The number of deaths recorded in UK hospitals now stands at 11,329.
There are also some positive signs from the data that we are starting to win this struggle. But we've still got a long way to go.
We're entering our fourth week of being confined to our homes. But in some European countries, they're starting to relax their restrictions. From the very beginning, the Prime Minister said the government's decisions were based on scientific advice. So who better to put your questions to than one of the key people helping Boris Johnson and his team, Sir Patrick Vallance, the government's chief scientific advisor. I spoke to him a little earlier. Sir Patrick, thank you for joining us. The first question for you comes from Chandra, who asks, how come in Germany they have been able to do so much more testing than the UK and keep deaths so low?
I think there are two bits to that. I mean, they have done more testing than us, and I think that is something we absolutely need to get right. There's no question, in my view, testing is an incredibly important part of how we need to manage this going forward. It was something that we raised right at the beginning as something that needed to be in place, and we need to get more testing. That's happening at the moment. I don't think that you should equate the testing, though, and the outcome in Germany. There are all sorts of reasons. I mean, there may be a relationship between the two, but there are all sorts of reasons why rates may be different in different countries. And I don't think testing alone is the major reason for that. And so we need to understand why outcomes are so different in some different countries. That may have to do with things like the concentration of people in cities. It may have to do with things that are to do with demographics, age structures of populations. It may have to do with other things on top of that. So yes, testing, there's a lot that we've got to get right on that. And is being looked at now by Public Health England and Department of Health, and they are getting that right. But I don't think it's as simple as to say lots of testing saves lives, because that isn't quite right, I think.
So you don't think we got the testing wrong in the UK at the beginning of this?
Well, I think the testing at the beginning was at the right level. I mean, I think at the beginning, Public Health England got off to a good start in terms of testing to try and make sure that they caught people coming into the country with it. I then think it's not scaled as fast as it needs to scale, and that's being done now. But I do think testing is an incredibly important bit of this. It needs to be done at scale, and it needs to be done rapidly enough to be able to look at outbreaks and isolate. And I think it's been good in terms of what's been able to be done in hospitals. It clearly hasn't been at the scale that's enabled all the healthcare working testing that's an important part of this. And I think that's why it's so important it does get into the right position now.
Bernard wants to know, do you think if we had gone into lockdown weeks earlier, it would have saved a lot of lives?
I think the question about when to go into lockdown is a really important one. And if you remember, we went in quite early compared to some other countries, and the lockdown became quite a severe lockdown in terms of the social distancing measures. If we'd gone into that, say, a month earlier, I think we would have probably spent a few weeks with absolutely nothing happening. Very difficult to know exactly what the effects on the outcome would be. I think that it's important that we continue it long enough. I think that's really, really important, that we don't just suddenly say victory, remove it immediately in totality. So I think the next phase of this is understanding how and when to release these measures in a way that's safe. And clearly, this is a nasty virus. It's a pandemic. It's across everywhere. It's very noticeable in the Northern Hemisphere across a certain range of countries. And we, amongst other countries in Europe, have obviously suffered badly with this virus. There's no question about that.
Question now that's come in from us from Anne. She asks, is the government still pursuing the policy of herd immunity that you personally and publicly were advocating in mid-March? If not, do you regret pursuing it when we should have been locking down earlier to save lives?
Well, let me first of all be crystal clear that we were never pursuing a policy of herd immunity. The point that I was making at the time was that at some point you need to get immunity in order to stop getting infection. And there are two ways in which immunity occurs. One is with a vaccine, and we're pursuing very actively the notion of trying to get a vaccine, either one that would come from some of the researchers in the UK or one that comes from overseas. The worldwide endeavour to try and get vaccines. Or you get some immunity because people have caught it, and clearly there's a little bit of immunity in the community because of that, but not a huge amount. And it's not possible to build up lots of immunity quickly with this disease for all the reasons we've seen. So that's not possible. So the herd immunity comments were really about trying to understand the fact that you need to get immunity at some point in order to stop this. That remains true, that's the way we stop this, or we end up with effective therapeutics. What we laid out at the beginning was a plan as to when we need to introduce the social distancing measures and to do that at scale across the population. And that was very carefully thought about in terms of timing. And we'll understand whether we got the timings exactly right or not. It's absolutely regrettable that we've got so many cases and deaths in this country, as indeed there have been in lots of European countries, some with higher death rates than us, some with lower. But I think we didn't lose time in terms of understanding what needed to be done and in terms of making sure that those positions were clear.
Anna wants some clarification on your role during the pandemic. She writes, we're constantly reassured by the government that they are following the science. Would you agree that the science is open to interpretation and that interpretation of the science can be political? Are you neutral on this, Sir Patrick?
Well, I completely agree that this is a difficult scientific area. It's a brand new virus. The world hadn't seen it before. We've got an entire population across the world that's never seen this virus and has no immunity to it. And the whole of the science community is learning about this day by day. So it's not the type of area of science where you have absolute pre-baked facts that are just facts. It's something that we're learning about all the time. And in that context, that's true for all of the science advice that's gone in. It's gone in with, of course, the caveats and the uncertainties clearly expressed. And my job as government chief scientist is very simple, and that is to make sure that uncertainty and what is known is clearly expressed to policymakers.
So, Patrick, I'm sorry to interrupt you there. Briefly, if you will, just one more question on who is affected by the pandemic so far. Raj wants to know, do we know if there is a disproportionate incidence of coronavirus amongst ethnic groups, and what should be done about it?
Yeah, that's a really good question. And it does look as though there may be some. And that's something that we're looking at very carefully to try to understand. And it's obviously, particularly noticeable amongst some of the healthcare practitioners who we've seen who've unfortunately succumbed as a result of this. So that is a key question that's being looked at now and trying to understand what might underlie such a difference.
Sir Patrick Vallance, thank you very much for joining me. Thank you.
Thank you.
We're still getting lots of questions about your personal health. Let's put some of them to Dr. Sarah Jarvis. Good evening. First question tonight, Sarah, is from Sarah.
If my husband, who is on the extremely vulnerable list, as he's having immunotherapy at the moment, and myself have both had the virus over the last couple of weeks, does this mean that he doesn't need to be shielded for the next 12 weeks?
Sarah, he does, doesn't he?
I think he almost certainly does. Part of the reason is that we don't know, or it's highly unlikely that we know, if he's had the virus unless he's been to hospital and has been tested. A lot of people, for instance, healthcare workers, when they were checked, often turned out to be self-isolating because they'd got symptoms of coronavirus, but often didn't actually have it when they were tested. So the first thing is, has he had it? And have you had it? Even if he's been tested, we can't be sure that you've both had it. The second thing is that although we think people will become immune to coronavirus if they've had it, there have been some cases in South Korea where it looks as if the virus might have been reactivated or people might have caught it again. But in fact, it's probably because the tests aren't terribly accurate if the patient's going through an asymptomatic phase, so they may just not have got rid of it. But we think people will be immune to it. But firstly, we can't be certain. And secondly, we don't know for how long. And given that he is having immunotherapy, that does make him, unfortunately, very vulnerable to complications. So I'm afraid I would be recommending shielding.
OK, a great question now from Nishanthi about not having symptoms. Let's listen in.
How can an asymptomatic person can pass this virus on if they have no symptoms, like a persistent cough?
Yeah, what's the science behind that? How do you pass it on with no symptoms?
Well, the World Health Organization wants to know the answer to that as well. And in fact, they produced the guide just about 3 weeks ago saying that, in fact, thus far, there have been no cases of asymptomatic transmission confirmed. They're not saying that doesn't mean there isn't any. That what they are saying is that there haven't been any confirmed, and therefore it's extremely unlikely. What they've also said is that there are very few people who are completely asymptomatic, but they may not have those classic symptoms of fever above 37.8 degrees and cough. They may just perhaps have a mild sore throat, a little bit of a cold type symptoms.
We've had lots of concerns about cancer treatment during the pandemic. This from somebody who preferred not to give us their name. He or she writes, I was diagnosed with stomach cancer in February. I was told it hasn't spread and I required surgery. This surgery was planned for the 2nd of April but was cancelled a few days later. I've received no further information since. When will life-saving cancer operations start again? Can you help with that one, Sarah?
It's a real challenge because it very much depends on the area of the country that you're in and what their local arrangements are. We do know, for instance, that in some parts of the country, people are being told that if they were due to have chemotherapy, that they should be putting off the chemotherapy because it would make them so much more vulnerable to developing severe complications if they caught coronavirus. If you're having just surgery for chemotherapy for cancer, then clearly that's not going to suppress your immune system in the same way, but you would be very unwell if you were having major surgery. The hospital may therefore have decided to delay things until we're past the peak, hopefully by only a few weeks, in order to reduce the risk that you developed coronavirus when you were very vulnerable when you were recovering from that. It may simply be that the hospital is overwhelmed. So we need to hold our nerve and keep up with all the measures that we're taking so that we can get past this peak, down the other side, and free up vital hospital services for urgent cancer treatments.
OK, Sarah, thank you for that for now. I know you're going to join us online a little later this evening. Thank you. We're going to take a short break now, but when we come back, our consumer editor Chris Choi answers questions about your coronavirus rights, life in lockdown this week, the view from the United States, and
I've done a couple of TikToks out recently with the girls, which really enjoyed doing that.
find out why dancing with her daughters is keeping Corrie Sally sane in self-isolation. Welcome back. COVID-19 started in China, but the country that's seen the most deaths so far is the US. Americans have seen weeks of grim headlines, including it being described as wartime in New York and a prediction that it could kill 200,000 people. Let's go live to Robert Moore, who is ITV News' Washington correspondent. Robert, America's been your home for some time, but you won't have seen anything like this.
No, you're right. I mean, these are extraordinary scenes. I mean, the vast majority of Americans, perhaps as many as 250 million, are in some form of lockdown or sort of some kind of shelter-in-place protocol that's normally used for mass shooting and now being used to try and handle this pandemic. New York, one of the most vibrant urban environments on the planet, looking like a ghost city, of course. And although that city may have passed its apex now, 10,000 or so have died in New York City, nevertheless, we get to see the impact across many other cities across America and indeed across rural America. And if you throw into the mix the fact that this is also a presidential election year, and you'll realize just what a surreal atmosphere we have in the United States.
Yeah, Robert, we know that President Trump had promised Americans, talking of that election, that the lockdowns there would be lifted by Easter. How are people reacting to the fact that they are still at home right now?
Well, that's right. There's been a very kind of debate, an animated debate here about when the sort of lockdown should be lifted. The president, of course, always who has judged his presidency by the stock market and by the economic numbers, is desperate to open up the American economy again. But his medical advisor is much more cautious. So, while the president was talking about sort of ending this lockdown as of the Easter weekend, that clearly is not practical, and we're now talking maybe another 3, 4, even 5 weeks before the task force that is dealing with this pandemic in America is going to lift the lockdown even gradually. So look, this is a marathon and not a sprint. We got maybe, as you say, that estimate of up to 200,000 Americans who might end up dying of this. But amid all of this human toll is the political calculation that is driving this White House. Still completely unclear whether this will boost the president's re-election hopes because he's the dominant figure in all of this, or whether there will be growing questions about his leadership and actually whether this will seal his fate as a one-term president. So many questions sort of ricocheting around the American environment, both about the human toll, but also in this election year about the political ramifications.
All right. Thank you, Robert. Thanks for that. Chris is with me now. Let's start with a financial question. We've had lots of those. Marie wants to know, will being furloughed affect my mortgage application?
You've got to admire the spirit of this question, haven't you? A lot of people will be outfaced by a mortgage application at the best of times. Marie is going on. The answer is yes. Increasingly, banks and building societies are taking into account your furlough income, not your old normal income, and there could be a big difference between the two, but not all banks and building societies have the same policies, so well worth shopping around.
Okay, lots of questions about working if you're not working from home or going back to work. Sarah Lou wants to know, I work in a small workshop. My boss has said she wants us to go back to work in May, but it's an enclosed space. I'm worried about whether we will be able to stay 2 meters apart.
It is a worry. And of course, we don't know what the situation will be in May. There'll be a review of these restrictions coming this week. Then we'll know more. What we do know is that employers have a legal obligation to put in all the right measures, including social distancing. If they don't, the health and safety executive says there could be enforcement notices, even closure notices. So if you can't reach a resolution with your boss, think about talking to the health and safety executive.
Look, we saw a lovely sunny weekend if you had a garden. What if you didn't? Jennifer wants to know, I have a communal garden. If I am out and my neighbour's children want to come out, I go back into the house. Can neighbours meet for a chat as long as they are 6 feet apart?
It's not really within the spirit of these guidelines. The idea is to keep different households separate to such an extent that a lot of councils now are suggesting that residents come up with a rota to make sure that there aren't more households in those communal areas than is necessary, and to minimise the amount of time that you spend there.
City living, really difficult at the moment. Another on this from someone who didn't want to give us their name. Someone local to me organised a street party in their close with everyone sitting in their own front gardens. Does this fit with the government guidelines?
Yes, if you wear party hats. I mean, it does sound a great idea. If you're lucky enough to have a garden whereby you can do all this and still be 6 foot away from all the other participants from different households, great. Of course, you will have to forego certain street party classics. You can't do the conga with the other residents, I'm afraid. That's a small sacrifice, I know, but, you know, you're going to have to adapt.
For the good of the country. Lots of questions still coming in about travel. Let's give you this one. Anisha says, we accepted the voucher for our flight as the refund wasn't an option at the time, but as the flight has been cancelled now, should we get a refund?
Can't say it too often that if the airline cancels your flight, you are entitled to a refund. You don't have to accept a voucher. In this case, it seems that Anisha did accept a voucher, and I suspect the airline will say, well, that's the end of things. That's our liability done.
OK, we've had a lot of people getting in touch who are animal lovers. This one from Paula really sums up the confusion about having a pet right now. How long is the virus thought to last on soft surfaces such as a dog's hair for?
Well, the British Veterinary Association has said that they've seen no evidence that suggests that companion animals are spreading this disease at all. However, the virus can live on surfaces, including an animal's fur, which is why it is now strongly recommended that after you've petted a dog, you should wash your hands. Possibly the same after you've petted your husband, Paula, if you've got one. Same basic hygiene for these companions nowadays.
Keep washing your hands, Chris. Thank you. And as ever, Chris will stay with me to answer more of your questions in a few minutes over on our website, along with Dr. Sarah Jarvis. Before that, we know the filming of the country's favourite soaps has been suspended because of the pandemic. So what's life like in lockdown for one of our most famous faces, the actor Sally Dinaver, who plays Sally in Coronation Street?
Hi, I'm Sally from Coronation Street, and this is my Lockdown with the Stars. The best thing about lockdown has been being together. It's just really nice to be with the kids, especially as they're getting older. I think it's that feeling of not being able to hug people that you love. I FaceTime them and ring them, but it's not the same. I'm not really missing selfies, no. I've done a couple of TikToks recently with the girls, which I really enjoyed doing that, just because it's a bit of fun. It's very difficult, that one, because I've got a vegetarian, I've got a vegan, I've got a meat eater, all in the same house. So every night is like 3 or 4 meals, to be honest. My guilty pleasure is chocolate and a glass of wine. I'm really enjoying doing all the mundane things like cleaning the skirting boards. Who would have thought I would have cleaned the skirting boards? The stay-at-home outfit is usually just a pair of slouchy jeans and a t-shirt, but actually that's what I wear all the time. I showered about an hour ago when I got back from Sainsbury's. Okay, I'm heading off now, everybody. Lots of love and stay safe.
Thanks for that, Sally. I'll be back at 8 next Monday. Thank you very much for watching. Have a very good evening. Bye-bye. Welcome back to Coronavirus Q&A Online. I'm here with Chris Joy and Dr. Sarah Jarvis. Sarah, if I can start with you, we've had lots of questions about dentists. Can we hear this one from Susan?
I've had severe toothache for over a week now and can't get any treatment. My question to you is, when are the emergency dental surgeries going to be up and running so that I can get some treatment?
Sarah, is that one you can answer?
It's a bit of a challenge because, as I always say, doctors are not dentists. Dentists are dentists, so don't show your GP your teeth. However, I did look it up. The Faculty of General Dental Surgery, Dental Practice, rather, has issued new guidance, and this was actually about 3 weeks ago now. And what they said was that basically all routine dental surgery stops anything aerosol generating. And the reason for that is rather like in intensive care, there's a real risk, a much higher risk of passing the virus on with things like dental treatments as there is with, say, intubation for ventilation. But in England, they recommend that we should be referring, or that dentists should be referring people to new local urgent dental arrangements. In Scotland, there's a similar thing, either in dental arrangements in the community or in hospitals. In Wales, it will be organised by local boards, and in Northern Ireland, people are expected to go to their own dental practice and they should be doing urgent procedures. Now, that's all we have. Those are in the process of being set up, apparently, in England. So I think it's really just a question of keeping on phoning your dental practice to see whether the message has changed.
Difficult times. A lot of people are still getting in contact because they are vulnerable, but they haven't had the letters, the 1.5 million from the government yet. Marie is one of them. Let's have a listen to what she has to say.
I have diabetes and COPD and have not yet received a letter to say I'm vulnerable. I contacted the doctors and was told to wait a few more days. Still no letter. Can you tell me when we will expect to receive these letters?
Sarah, she's not alone, is she? She's got diabetes and a lung condition, and she just hasn't had that letter yet. What should she do?
So she's technically not in the very highest risk group unless her GP says she is. And one of the problems we've got is that people who've got several conditions that make you high risk probably are highest risk, but they haven't necessarily been identified. So the original group was done on centrally held data. So that was people, for instance, who'd had an organ transplant, people who had bone marrow cancer or blood cancer, people who are having active chemotherapy or radical radiotherapy for lung cancer, immunotherapy for cancer, people who had cystic fibrosis, etc. So they're very clear. So first of all, there was centrally held data. Then the government interrogated the GP practice data to see if they could pick up more, because the original group was about 900,000. Then GPs have just in the last day had a letter or a list from the NHS saying, OK, please look at this list and see who else needs adding. And we've been given 1 day until tomorrow at 5 o'clock to get that out. And then the last group are people who've self-identified. They've gone on to gov.uk/coronavirus-extremely-vulnerable, registered themselves. Those will be sent to GPs, that list, by about this Friday. That's the 17th. And GPs are expected to get the list back by Monday night, the 20th. So at the latest, it should be next Monday, the 20th, and those letters should be going out from GPs. If you're not on the list but your GP thinks you should be, they should be going out tomorrow.
OK, so people will have to be patient with that one. One here from Claire, who has got a very specific question about whether to self-isolate or not.
My 13-month-old son had his vaccinations 1 week ago. He woke this morning with a temperature of 39.4 and it's coming down with Calpol. He doesn't have any other symptoms. Should we as a family be self-isolating?
What's your take on that one?
Oh, that's a really difficult one, because technically you're quite right. He does fulfill the criteria because he had a temperature above 37.8 degrees. However, as Claire has so rightly pointed out, this is very common after immunisation. So my feeling is that given that everyone's supposed to be kind of pretty much self-isolating anyway, just take it to that little extreme, and just for 1 week for that child I think it probably is worth self-isolating just to be on the safe side. But of course, that will be 2 weeks for the parents. I think the chances are this is going to turn out to be due to the vaccination, but I don't think you can afford to take that risk.
What's your advice of people asking whether their business, if they're still going to work in a place of work, should be shut down if somebody has been confirmed with COVID-19 in the workplace?
That's a very difficult one, because technically it's not somebody you're living with. However, if you are in close contact with those people, and that's really within 2 meters for any length of time, then effectively it is equivalent to living with them. And therefore, from my perspective, my feeling is if they've got confirmed coronavirus, certainly the business really should be shutting down so that everyone can self-isolate for 2 weeks. If somebody has symptoms, that's slightly more challenging, because if anybody has gone off and hasn't come into work with it and has developed symptoms, perhaps say over a weekend, and hasn't come in, the risk of them having passed it on before they developed symptoms was lower.
Okay, Sarah, just before I let you go, I know you answered this last week, but it is a kind of ongoing, continuing discussion about the use of masks. We know that the government said today that they're looking at the press conference at evidence regarding masks, and the World Health Organization has also talked about changing advice there. Nigel says masks are being used by frontline NHS staff to help prevent infection. Is it therefore logical for all people to wear masks when one is out of one's home? What's your latest opinion on whether we should all be trying to get masks right now?
Okay, so really it's a question of whether you're looking at a surgical mask, which is much better than a cloth mask at preventing infection. There's no doubt that healthcare workers can reduce their risk of getting the infection by wearing a mask and by putting it on properly, taking it off properly. However, cloth masks, which is what most people are looking at, and certainly what's being advocated in the United States, the European Centre for Disease Control has come out and says, well, they may reduce the risk of passing it on, but of course that would be through coughing or sneezing, and we hope that the moment anybody coughs or sneezes, they self-isolate, so that risk would be small, and the risk of passing it on if you're asymptomatic is very small. If you're hoping to reduce the risk of getting it yourself, there is very little evidence that cloth masks do that, whereas the surgical masks, particularly the very effective FFP3 masks, which are used in ITUs and so on, they do reduce the risk of catching it.
Okay, and obviously we need to make sure that all NHS workers still have good access to those. Dr. Sarah Jarvis, as ever, thank you very much. Chris, if I can turn to you, let's start with a question from Tanya on this issue of furloughing. Can you be furloughed if you live with someone who has received one of the NHS letters Sarah was talking about, telling them to shield for 12 weeks?
It's fascinating, isn't it? Just a few weeks ago, nobody used this word furlough on this side of the Atlantic. Now we're all becoming experts in this scheme, also known as the government's job retention scheme. The good news for Tanya and others in her position is, yes, you are eligible for this furlough scheme if you're living with somebody that's been told to shield for 12 weeks. It means, of course, you have to get your boss's sign-off. It's got to be agreement between the two of you. It means that you won't be able to work for your employer during that period, and you'll get from the scheme 80% of your usual salary.
Okay, really clear answer for Tanya there. Gemma wants to know, I'm a single mum, she says, with a 4-year-old son. I work 2 nights a week at a supermarket. Can my son's dad stay at my house to look after him while I work? She's obviously a key worker at the moment.
It's a great one, yeah, and everybody, I'm sure, would want to make life as easy as possible for supermarket workers. They're doing a vital job, a great job. It's hard work for them at the moment. Strangely, there is within the guidelines a very specific allowance for children whose parents are separated, for those children to go between the homes of the separated parents. And this is a slightly different thing that we're being asked here. So it would be far better if the son would go and stay with his father rather than the father moving in to his former partner's household. So much better to do it that way, if at all possible.
Because that's well within the rules. One here from a person who describes himself as a worried plumber. He says, or she, I work for a local council and we're still being made to service boilers in many houses each day. Why can't gas safety certificates just be extended without an inspection?
Yeah. This actually has come up a lot with people seeing perhaps the safety checks as being a little bit bureaucratic. Couldn't they just be waived for the period of this crisis? The fact is that people are still allowed to go into others' homes for maintenance work. Obviously, if there's shielding or self-isolation or symptoms involved on either side, that should not be happening unless there's a safety risk. But specifically, as far as these gas safety certificates are concerned, there has been a special appeal for landlords to keep up with them, because to not do so could expose tenants to risk, especially at the moment when so many people are spending so much longer in the home. It's important that the gas fittings are safe.
Yeah, I mean, we don't want to create extra problems on top of what we're dealing with already. Somebody here about moving house, Diana, quite a long question, so bear with me. We were about to move house on the 27th of March, just days before the final paperwork was about to be signed by everyone in the housing chain to be able to move on 27th of March. The lockdown came into being in the UK. So the process of moving house is now on halt in the housing chain. When can we move house? Can you answer that?
Poor Diana. I mean, the frustration of it. It's so difficult to get all those parts of a property chain to lock together. And
in
then
normal times,
this happens. The answer to the question is we can't be sure, because we just don't know how this is going to pan out. We saw in the government's press conference today, we've got a long way to go on this. The government's specific advice for people in this situation is to try and reach an amicable agreement on a new move-in date beyond when these restrictions are enforced. We don't know when that will be, of course. What we do know is that banks have agreed to keep mortgage offers open for up to 3 months to just get people through this very difficult, unsettling period, especially if you're in that very vulnerable financial and household position of being trying to move.
Okay, so those mortgage offers, they're on hold then
They
while we deal with this. A couple of questions about holidays. Karen says, Jet2 have cancelled our flights for our holiday in May, so I have had to cancel my airport parking, but they are charging me £15 to cancel. Can they do this? Can they get away with that?
I've read a little bit about this. Yeah, it does happen quite a bit. You will find, not always, but often, that buried in the terms and conditions of the car parking deal that you've got, the contract there will say that they're entitled to take some admin fees, even when refunding, and that is happening. Other car park operators, they don't have that. You'll just get a full refund, but it depends on the contract that you're involved with when you took out the car parking in the first place.
Goodness, right, somebody who doesn't give us their name. We have paid more than £2,000 in fees for our holiday home for this season, but have been told we can't use it for obvious reasons. Is the government going to help with the fees or even get next year free?
I don't think I've heard this something mentioned in terms of any kind of government bailout at the moment. And from hearing that question, it sounds rather like there is a contractual obligation to pay those fees. And no doubt the management of the facility where the holiday home is would argue that they're still maintaining the grounds, perhaps still maintaining the buildings, the shared facilities. So they do need that income. So I think those outgoings will have to continue. I suppose on a more positive point, it's early days yet. There might still later in the season, later in the year, be that opportunity to go out and spend some time in the holiday home. I certainly hope so.
Yep, I think we all do. Somebody writes here again, anonymous, I have recently had to stop driving lessons and I'm wondering if it is acceptable to practice driving with a provisional licence. I would not come into contact with anyone other than one of my parents who needs to be in the car with me when I do so. My theory test pass will no longer be valid past September, so the hope is to get the practical done in time. Can I go out driving?
How to gently break this? No, this would not be regarded in any way, shape or form as an essential journey. And the spirit of these guidelines are all about reducing road use. The more cars on the road, the more journeys that are made, the more the chances of accidents, which will add to the NHS load. In terms of the theory certificate, you may well run out of time for that, in which case you'll have to go back and book another theory test and pay for it a second time, I'm afraid.
Yeah. Okay, let's finish with this one then about cash. Again, no name, but they want to know, I have been told by my bank and the local supermarket I can no longer use my cheque to withdraw cash and will have to use the ATM. I'm worried that this is putting me at increased risk. This thing about access to cash and to money is building, isn't it?
Well, yeah, I can see the concern, because certainly an ATM would be a hotspot. You've got the touch screen, you've got the keypad, a lot of people in contact with those things, which is why the advice is to wash or sanitize as quickly as you can having used an ATM. I've seen people using disposable gloves whilst they've been on them. Another solution, of course, is, if at all possible, to switch to using more contactless means of payment, contactless cards, etc. Would be better than having to go to the ATM. But if you do have to go, take those precautions.
Yeah, and as you say, just keep washing your hands. Chris Choi, thank you very much. Dr. Sarah Jarvis, thank you very much. We will be back here around 8:30 tomorrow night. Thank you very much for watching. Bye-bye.